Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about medically induced labor. Watch this video till the end. You will understand better the various methods and what to expect. Induction is the formal term for the process of stimulating uterine contractions before you naturally go into labor. Some 22% of pregnant women in the United States have their labor induced, according to the American College of Obstetricians and Gynecologists. To induce labor, doctors commonly use various methods and techniques like membrane sweeping or medications. Learn all about these common labor induction approaches and why it's important to keep in constant communication with a healthcare provider as you consider ways to speed up labor. Many doctors will recommend induction if your pregnancy goes beyond 41 or 42 weeks, since your placenta becomes less efficient at nourishing your baby by that time. Some doctors suggest inducing at 39 weeks since research shows that babies born then have the healthiest outcomes. Before that, induction is only recommended when your health or your baby's health is at risk due to infection, a medical condition like preeclampsia, low amniotic fluid levels, or other problems. There are many ways that a medical professional can induce labor. All of these methods should be performed only by a doctor or, in some cases, a midwife or doula. Don't try them yourself. A recent study found that people who had elective labor induction at 39 weeks were not more likely to have a cesarean section than those who went into labor after their due dates. This supports the safety of elective induction at 39 weeks. Membrane sweep. Membrane sweeping or stripping is when a doctor, midwife, or doula gently separates the amniotic membrane from your cervix to stimulate the release of prostaglandins, hormones that are essential for ripening, softening, the cervix in preparation for delivery. Membrane sweeping is done in the office setting after 38 weeks. There could be light bleeding from the cervix, and sometimes your water may break. This procedure is sometimes offered at term once your cervix has begun to dilate. For most people, this will cause the onset of labor within a few days. Balloon catheter. A balloon catheter, otherwise known as a Foley bulb, is another option to discuss with your medical team if your birth is being induced. In this procedure, a catheter is placed and inflated with sterile water above the cervix, inside the uterus. The balloon mechanically dilates the cervix. Balloon catheter induction does not require the use of medications, however, it can be used in conjunction with medications such as Cytotec, misoprostol, which is a small tablet placed by a doctor or midwife into the vagina or taken orally that will release prostaglandins to help soften the cervix and cause contractions. When used in conjunction with medication, the balloon has been shown to increase the chance of delivery within 24 hours. However, the procedure can be uncomfortable, and those with ruptured membranes cannot take advantage of this option. In addition, patients with previous C-section scars should not use the misoprostol pill because of the risk of uterine rupture. Amniotomy. Most people go into labor within hours after their water breaks, when the fluid-filled amniotic sac bursts. By artificially rupturing this sac, your doctor can jumpstart contractions that have not begun yet or have stalled. To do an amniotomy, your doctor will use a special device to create a hole in the sac with a special device. Sometimes, medications are used along with this procedure to move labor along. Pitocin or oxytocin 4 infusion, administered at a hospital under close medical supervision. Pitocin and oxytocin infusions can be used to increase the rate and strength of contractions, while the medication dose is continually adjusted to achieve an adequate contraction pattern. Fetal heart rate changes are continually monitored to ensure the well-being of both mother and baby. If contractions are not well tolerated by the baby, this will limit the ability to administer oxytocin. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.